If your beard hasn't grown sufficiently, please consider going for a retake. A very warm hello to all of you, my dear and valued viewers. I extend my sincerest welcome. We have a new patient who has just arrived, and her name is Diana. She is here for a consultation. All right.
Hello viewers, patient Diana is here. She'll explain her knee pain from sports. And for the most part, the constant strain is always primarily on my knees, so from time to time they frequently ache. And also, the upper thoracic part of my spine is a bit consistently troubling for me.
Lower thoracic.
It's always the lower thoracic.
I want to add, when we talk about the gym here, it's a bit different. Here it's karate.
Gym, knee strain, spine concern. Karate differs. I do another sport. Most often the training sessions, really serious training sessions, where a lot of muscles are involved, and accordingly, most often it's focused on the
high point. These are very energy consuming sports. Well, we're going to be careful today. We don't need karate. So let's move on to the examination and finally start our monotherapy. Let's get to work. So let's proceed to our standing examination. Let's start with palpation. Diana, the floor is yours. Palpation, Tatiana. Report discomfort. Right side very palpable, especially at the top. Feels like a stone. Clear trigger points. Broad back, unlike previous patients. Well, it's actually not that bad yet, especially when people first come in for their initial assessment. Of course, these crucial muscles are undoubtedly suffering quite a bit, experiencing significant strain and discomfort. Now I'm going to gently ask you to carefully bend over even lower, really trying to extend your reach as much as comfortably possible. That's perfectly fine. Just come slowly back up to a standing position. Good, excellent. Now, please carefully lie down on your back on the examination table, making sure you are completely comfortable. So, dear viewers, we've already done a warming massage and a brief examination, but we'll repeat it once more. So, what is bothering us here? Let's start with the lumbar region. As the quadratus lumborum muscle is satisfactory, there is no obvious tonus on either side.
unbearable, excruciating, severe pain.
In the spinous process is often associated with trauma. A particularly common occurrence is a compression fracture. The spinous process is more sensitive, right?
Yes, that is.
Is it really protruding? Very much so. Well, let's try to do a decompression, stretch it out, maybe the pain will go away. The left side of the cervical collar area is much calmer. I wouldn't say it's perfect, but compared to the right side, well, now it's already much softer. Diana, how do you feel yourself? Right in this area, it's a real trigger point. We also worked here with a cupping jar, but this isn't something that can be fixed in just one session. We also worked here with a cupping jar, but overall, this area can't be fixed in just one session, that's for sure. So are we both ready? Let's get started right away and we'll probably begin with the lumbar region. Actually, no, I don't mind. Let's go through each manipulation step by step. I'll perform each one. So let's start with a stretch. Maybe even do a little work on the skin first. Let's move straight to the lumbar region as well. We'll do a lateral stretch. We grasp the ribs from the 12th down to the 8th, almost to the edge of the scapula. We pull back. And here, the pelvis and the stretch. Same thing on this side. Lateral, that's it. Don't help Diana. And right here. Diana is calm on her own. The main thing is for Diana to stay calm. Are you relaxed? A bit more. Good. Lower thoracic region. Is everything okay? Diana, stay calm on your own. The main thing is for Diana to stay calm. Relax. A bit more. Good. Lower thoracic region. Breathe. It's quite tight here. Not bad overall. Now we will approach this exercise with a slightly different method. Let's gently and slowly lift your head upwards at this moment. Carefully turn your gaze and entire head to the right side, observing your surroundings. Now with a smooth and unhurried motion, release your hand from its current position, allowing it to relax completely. That's very good. You're doing wonderfully. We will now proceed to replicate this entire sequence on the opposite side of your body. So once again, gently release your hand, letting it go completely. Excellent. That's exactly what we're looking for in this movement. That's enough. It's tight, definitely tight. Your body is a bit tense. Diana, now your task is to turn onto your right side. Go ahead. Toward me. It's quite tense, definitely very tight. The entire body is a bit tense. Now, your next task is to gently turn onto your right side. Go ahead, move slowly towards me. Now, whose metal chain is this exactly? That's the left one, and it feels quite hot. Gently bend your lower arm, positioning it comfortably under your head, just like this, creating a soft cushion. Now slowly and deliberately move your entire body closer to me, ensuring a snug and supportive position. Next, carefully bend your upper leg, bringing it forward, then smoothly stretch it back, extending it a bit more, feeling a gentle pull, and then even further back, really reaching. Take your time. Easy now, just relax a little bit more into the position. That's very good, excellent. Now we will proceed to the other side, repeating these precise movements. Gently bend your arm comfortably under your head and then slowly stretch your entire body in the completely opposite direction. Good. Lying on your stomach, stretching the thoracic area and the lower upper part didn't really work out. Let's do it a bit differently. We'll put the emphasis on lying on your back. Bend arm under head, stretch opposite, stomach stretch for back failed. Now on back, patient relaxed, don't help, let legs go. Get up through your left side. It didn't hurt just now, did it? Get up and do. Good, lower it down. Get up through your left side. It didn't hurt just now, right? And there was no discomfort, but everything still happened. Get up, clasp your hands behind your head with your back to me. Yes, that's right. Head down. Good. Carefully lower it down, ensuring a comfortable and tolerable position. Now gently sit like this, maintaining a relaxed posture. Then slowly turn your head to one side, observing your surroundings. After that, smoothly turn your head to the other side, as you absolutely need to thoroughly check both directions for complete awareness and safety. You're not exaggerating anything, are you? Relax. More. Relax. Let your head drop a bit. Good. Now side bends as well. Toward one shoulder and then the other. I'll come over now. Good. Could you please move back just a little bit more toward me if you don't mind? Slowly bring your upper torso gently toward your extended leg and then lower your shoulder downwards. Lie down on the other side. Move back slightly. Bring your torso toward your leg. Lower your shoulder. Lie on your stomach, chin on mat. Arms along your sides. Gentle lateral stretches for the cervical spine. Effective for improving flexibility. Along the cheeks. Arms along your sides. Lateral stretches for the cervical spine. Good.
You'll like it. It's just that in Europe, how often did they wrap you up? First, when you align the vertebra, and then as people get older,
They get up and it's like they start living all over again.
like that.
So actually, decompression really quite significantly helps. Okay, we are now ready for our decompression. Please lift your chin up just a little bit. No, yes, that's perfect. Landing permitted. That was indeed Diana's specific line, and she was absolutely supposed to say that particular statement. Diana, relax.
Hit the target squarely.
Hit him. So please tell us more now. I'm more interested in the thoracic region. Landing permitted. Everyone ready? Relax. Hit him.
I want you to the right.
Spot stretched.
Yes, but it's like the right side stretched out more, kind of like that. Right now, as we're stretching, I could really feel it in my neck. Yes.
Is there any pain anywhere right now? Is there any significant pain anywhere at all right now? Or perhaps some discomfort will eventually appear. It grew for absolutely no discernible reason. It truly grew. I'll become quite famous and... Alright, now once again, let's go a bit lower. I've already done one. Let's lower the head even more. Lower it right in that spot it grew. Great, I clearly see exactly where you're going with this, what got wonderfully stretched just now. Well, the entire neck and the chest too, right? Let's stretch it again, that's very good. Now let's gently stretch the legs, specifically focusing on the knees. Let's take a careful look. Please relax your leg completely and thoroughly. Such extreme hypermobility. That's precisely what truly grew and developed, but not yet. Are you completely controlling exactly where it's going? Total and absolute control. You definitely need specialized insoles for that particular situation. There's such significant mobility everywhere, like joint hypermobility, and the knees really do bend backward, and the hips too. Insoles are needed. There's hypermobility everywhere. Knees and hips bend backward. Turn onto your stomach, get on your elbows, like a plank, but don't lift your torso. Bring your elbows together. Move your elbows slightly forward, keep your torso in place. Look forward, Diane. Get up on your elbows. Bring your elbows together. Move your elbows slightly forward. Keep your torso in place. Look forward, Diane. Lie down. No. On your stomach. Arms along your body. Like that. How is it now? The same? The same. Does the discomfort or any irritation from the spinous process bother you less now? In any case, it is quite important that you take some time to walk around here a little bit, perhaps for a few minutes, to gently stretch it out and allow it to loosen up a little. That feels good. Let's get up, Diana. Well, dear friends, that's it for today's session. Now, Diana will basically share how she feels, her overall condition.
At the moment, my back feels quite relaxed, and I don't really feel the muscles. It definitely feels lighter, honestly, in the thoracic area.
Stretching the whole spine, everything has improved quite a bit. The only thing I'll add is that there's still some work to be done here. Professional sports bring a lot of injuries. I'm all for sports, but everything should be done wisely. Like and dislike the video. Be sure to subscribe to our channel. It's important. It motivates us in our work. And we will keep filming and making more videos. It will only get more interesting from here. Thank you all.